I think people are very interested in this EMDR versus CPT. And I know you're not against EMDR or anything like this. Just, can you help people, just if you had to say what the main difference is between CPT and EMDR, and if they're trained in EMDR, should they get trained in CPT? Can you just help us differentiate the two?
Absolutely. Sure. Francine Shapiro was actually a good colleague of mine, and contacted me years ago about trying to combine CPT and EMDR into one therapy and to see what we could do with it. And we never brought that to fruition. But I think, when I talked to Francine, she kind of classed EMDR not as a cognitive therapy, not as exposure therapy, kind of a hybrid. And so I think the big difference is CPT stays very firmly in that cognitive behavioral place, and EMDR does sometimes involve exposure to the memory. I will tell you, I'm doing a study right now of accelerated resolution therapy compared to CPT, which is the closest friend to EMDR. And some people actually in the EMDR world consider ART to be a shorter version of EMDR. I will tell you the last patient completed therapy this week. So we're into follow-up assessments, and we will have that data for you all. But I think that'll be the first time EMDR or any form of EMDR has ever been compared to CPT, ever. And so I think it'll be really nice to be able to get that data out there. But again, the thing I like about EMDR, and I've actually hired an EMDR clinician who works for me right in the office next door, is it gives patients options. So yes, if you're trained in EMDR, you're going to be the first to tell me it doesn't work for everybody. And I'm going to be the first to tell you CPT doesn't work for everybody. And that's why I think if we love trauma therapy and that's where our heart is, then we should get trained in as many of the evidence-based therapies as we can, so that we've always got something else in our back pocket.